Hi, my name is Corey Colson, and I'm a registered dietitian, nutritionist, and certified diabetes educator. And today I am taking over Kim's YouTube channel. I currently work in a diabetes outpatient clinic. Also work with teaching injections, whether those will be insulin injections or your GLP-1 injections. I also help with educating patients on insulin pumps. Also assisting the doctors with insulin pump changes as well. Really passionate about diabetes. Diagnosed with type 1 diabetes about 10 years ago. So diabetes has always kind of been, a passion of mine, something I really wanted to work in. Kind of talk about your basal insulins and your bolus insulins, how they're kind of working, look at the onset, the peak, and the duration of those different types of insulins, but then also the role of the registered dietitian, the role that we have in helping patients kind of understand about meal planning with insulin, carb counting, and things like that. I'm going to kind of start with your typical bolus insulins. We kind of call them rapid acting or fast acting or mealtime insulins. And so these are ones that are typically administered prior to a meal. So they help to cover those carbohydrates that we have. It's really important patients really understand that, when they're taking these medications, bolus insulins, they need to make sure they are eating foods that have those carbohydrates with them so that way we can prevent or at least reduce the risk of hypoglycemia. Okay, so looking at our bolus insulins, we have, of course, our rapid acting insulins and then our short acting insulins, but they're both still classified as our bolus insulin. Again, we're going to take it with the meal. So there's actually a newer bolus insulin out, Fias. It's been out just for a short period of time. That's kind of our ultra fast insulin there. So what the onset is how fast the insulin is going to start working. Then the peak is when it's going to work at its strongest. So that's typically where it might be higher risk for hypoglycemia, but then also the duration of that insulin also. Again, we want to know how long it's going to last in the body because, again, that can also result in hypoglycemia as well. Starting with Fias, it is a rapid acting insulin that's going to work really quickly and be out of the body pretty quickly as well. So the onset, or how quickly it starts working, is about 2.5 minutes. So again, really, really fast. So it's going to get in really quickly. It's going to peak at about an hour or 60 minutes and then be out of your system by 3 to 5 hours. So like I said, it's going to be in, it's going to do its job, it's going to be out. Now, when we look at our other rapid acting insulins, they're just a tad bit slower. Those would be similar to your Novalogs, your Humalogs, or Pedra. So I like to use the brand names when talking about the insulins, getting easier for me. They'll start working at an onset time. It's going to be about 5 to 15 minutes. And so the peak is going to be about 30 to 90 minutes. And it's going to be out of the body in less than about 5 hours. Again, still getting in there pretty quickly, acting really quickly, and then getting out of the system as well. The other type of bolus insulin is going to be what we call more of a short acting insulin, and that's what we call our regular insulin. So again, this one's working just a little bit slower, but it will help again to cover some of those carbohydrates. So with our short acting insulin, which is our regular insulin, this one's going to work a little bit slower than those rapid acting insulin that I spoke of earlier. And so this one's going to start working in about 30 to 60 minutes. And the peak is going to be around 2 to 3 hours, and the duration, or how fast or long it's going to stay in our body, is going to be about 5 to 8 hours. So again, in comparison to some of those slower acting insulin, it's still going to get in, pretty fairly quickly, and then be out, and again, about 5 to 8 hours. And again, all these times are really, estimates. There's a lot of other variables that kind of determine how fast, how quickly insulin is going to work. Everyone's different. Their sensitivity to insulin is different. And there's a lot of different factors that affect exactly how long insulin may work. So those are our bolus insulins. Again, these are insulins that we will be taking with meals to kind of cover the carbohydrates that we are consuming to ensure that we're not having those elevated glucose after or following a meal. And so the efficacy of these medications is determined by the next meal or the blood sugar following that meal. So between the bolus and the basal insulin, there is more of an intermediate acting insulin, and that's called NPH. And so NPH insulin is going to work again slower than the bolus insulin, but faster than those long acting insulins. But it's not as stable as those long acting insulins. There are those basal insulins. So NPH again works a little bit slower. So the onset is about 2 to 4 hours. It's going to peak in about 4 to 12 hours and then be out of our system typically typically around 12 to 24 hours there. This is one that you may take 2-3 times a day. Kind of depends on where the patient is with their diabetes management. And so that's your intermediate acting. So we have our bolus, again, which is going to be our FIABs. There's going to be our Novolog, Humalog, Apidra, short acting, which was our regular. And then we have the MPH as our intermediate.